Hi, this is Dr. Kalyan and welcome to MedVas. And here we regularly discuss the previous year question of professional examination, mainly from the West Bengal University of Health Science. Now, today's question is from second prof MBBS pathology question. It came 2017 paper 2. Now, the question is 55-year-old lady presented with hard non-tender mass of about 5 cm in diameter in the left breast and retraction of the nipple. Now, the first part of the question is what is your provisional diagnosis? In it carries 2 marks. So, your answer is my provisional diagnosis is CA breast left side. So, your provisional diagnosis is CA breast left side. CA breast that is carcinoma of the breast left side. Now, as the question carries 2 marks, so if you write only this is a provisional diagnosis is carcinoma of the breast left side, that's not enough. You have to write down the point which support your diagnosis. That is, so you have to write the following point support my provisional diagnosis. And what are the point written in the question? That is first 55-year-old. At this age group, mainly carcinoma of the breast occur. If in this question 25-year-old lady is written, that is not mainly due to the carcinoma of the breast. At this age group, that is postmenopausal woman, 55-year-old, that is the age itself is a support of your diagnosis. And now the second part is hard and non-tender mass, and any hard mass in the body is suggestive of carcinoma. If the mass is soft, that is suggestive of benign tumor in the body. Any hard mass is suggestive of carcinoma of the carcinoma, and any soft mass suggesting the benign lesion. So, and non-tender. And what is the significance of the non-tender? If there is tenderness, there must be inflammation is going on. That is infection in the breast. If breast abscess occur, there is tender mass is seen. But the mass is non-tender. That is also suggestive of malignancy. And the diameter also suggestive. That is a 5 cm diameter. That is a big diameter. So, big diameter also support your diagnosis. And the main point is retraction of the nipple. And how retraction of nipple is due to the infiltration of the lactiferous duct of the lactiferous duct of the breast. So, there is retraction of the nipple. So, your answer will be, this is a case of CA breast, that is carcinoma of the breast left side, and the following point support my diagnosis. These are the age 55 year, hard mass, non-tender mass, diameter of the mass, and the retraction of the nipple. Now, the second part of the question is describe the plan of investigation for these cases. Now, this is a universal rule. When a patient came with breast lump to you, your approach should be triple assessment. And what are the components of triple assessment? The triple assessment, the component are: first, you take the history and clinically examine the patient. Second, the radiological examination. You send the patient for radiological examination various. And third, the diagnosis confirmed by the biopsy. So, it is a universal rule. In your clinic, when a patient of any age group came with breast lump, your approach must be triple assessment. That is, what are the component of triple assessment? First, you take the history and clinically examine the patient. Second, you send the patient for various radiological investigation. And third, confirm the diagnosis by biopsy. Now, I will prepare a PPT what you will write in the exam, and I will post it on our Telegram group. Now I will discuss briefly here what are the points suggestive of malignancy and what are the points suggestive of benign lesion and how will you approach the patient. Now, when a patient comes, you take the history and what are the importance of the history. First, you take the family history. In the case of breast carcinoma, the family history is very important because the particular gene BRCA1 and BRCA2 are related to the familial cause of breast carcinoma. So, family history is very important. Second, the age of the patient is very important. If a 25-year-old female came to you with the breast lump, this is not mainly due to the carcinoma, but at the postmenopausal age, when a lady come with breast lump, it is mainly due to the carcinoma of the breast. And third, you take the history of any radiation exposure or any radiation exposure or previous history of radiotherapy. These are the history point, and when you and next you go for the clinical examination. And what are the point important in clinical examination? When you palpate the mass, just look for the mass. Any change in the breast skin occur or not. That is, if you see poddy orange, that is definitive feature of the carcinoma of the breast. If you see there is ulceration over the breast, that is also suggestive of breast carcinoma. If you see retraction of the pupil, if you see puckering, if you see dimpling, that is also suggestive of breast carcinoma. And now when you palpate the mass, if the mass is hard, if the mass is not movable, then it is also suggestive of breast carcinoma. Now you, after the clinical examination and history taking, you send the patient for radiological examination. Now, if the lady's age is more than 40 years, then your radiological investigation would be mammography. What is mammography? Mammography is the X-ray of the breast, and if the age of the patient is less than 40 years, your investigation of choice is USG. And in special cases, that is where the family history is positive, family history of the breast carcinoma is positive, or any breast implant, then you go for the special cases, you go for the MRI. So, why we prefer 40 years old lady mammography, less than 40 year USG? Because the young breast is dense. So, if we do mammography in young breast, the whole film look white. So, you can differentiate between the carcinoma and normal breast tissue. So, if the lady is age is less than 40 year, we prefer USG, and if the age is more than 40 year, we prefer mammography. Now, in the mammography there is a score, BIDAT score. The radiologist give you the BIDAT score, and BIDAT score has 6 point, and according to the radiological finding, you finally go for the biopsy. And what is the biopsy? Biopsy in the breast is called true cut biopsy. True cut biopsy has a special to take true cut biopsy, you have a special instrument, and by this instrument, that is called true cut gun. By this gun, you take slices of the tissue in that lump, and finally see under the microscope and confirm the diagnosis. So, first we take history and clinical examination, then go for the radiology, and radiology give you the BIDAT score, and according to the BIDAT score, your diagnosis is confirmed by the biopsy. This all, and the third part of the question I will discuss in the next video. Thank you.